Please welcome Dr. Abhishek.
Well, good morning, everyone, and on behalf of the Prevent Cancer Foundation, I thank all of you for taking time on Hepatitis Testing Day to think about the link between viral hepatitis and liver cancer. And I want to start by thanking the partners for including us in this event. It's really great to see everybody out on this wonderful sunny day, but to discuss a subject that's really serious, but a problem that we can do something about, and that's always good to know. There's something that can be done here. If we want to save more lives, it's important to acknowledge that cancer prevention and early detection are a really important part of this discussion. I started the foundation a little over 30 years ago to redirect the cancer conversation from treatment and cure to prevention and early detection. We've been successful in raising awareness about the proven ways to prevent many types of cancer. But there is still much more work to be done, and you've just heard a lot about that. Specifically, and as you just heard, many people are unaware that hepatitis B and hepatitis C are risk factors for liver cancer, a deadly cancer that unfortunately is on the rise in this country. So we launched a campaign called Think About the Link. It's a public awareness campaign, for the first step of which was to commission a survey. We talked to both healthcare professionals and the general public to understand the familiarity, the perceptions, and the behaviors of these individuals as they relate to the link between viruses and cancer. And our campaign includes not only hepatitis B and hepatitis C, but also HPV, because there's a very low awareness about the numbers of kinds of cancer that HPV causes. But some of the findings in this research we thought were quite remarkable. And it's remarkable for what people don't know. 61% of adults are unaware that there is a hepatitis B vaccine. That's really amazing. These days, babies are supposed to get it, newborns are supposed to get this vaccine. 75% of adults are unaware that the hepatitis B vaccine can lower the risk of liver cancer. 75%, that's 3 out of every 4. And 73% of adults, almost 3 out of every 4, are unaware that treating hepatitis C can reduce the risk of liver cancer. So there's a lot of work to be done just to raise awareness. And finally, while 70% of healthcare professionals indicate that the cancer prevention message is effective in ensuring hepatitis B vaccination compliance, only 27% of these respondents, these are healthcare professionals, reported employing these strategies with patients. So that's a huge disconnect. Again, we have lots of work to do. We must draw the link between these viruses and cancer for the public and for healthcare professionals. So that's why I'm here today. As part of our campaign efforts, the Foundation is working with the Hepatitis B Foundation and many other groups across the country to hold local events to raise awareness of the link between hepatitis B, hepatitis C, and liver cancer. We are delighted to have the involvement of Philadelphia's city officials, and we especially urge them to support and promote testing efforts. The Philadelphians who are at highest risk for hepatitis B and C infection are using these health centers as their primary health care, so it is vital that they know about testing and test these individuals. The hepatitis B vaccine, I can't say it too often, treatment of hepatitis C can prevent those at risk from developing liver cancer and experiencing its deadly effects. Please help these individuals live cancer-free lives by creating improved opportunities for testing for these viruses, including raising awareness that they even exist. Thank you so much for your attention.